Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 10 of why you can still have back pain. In this video, the hidden secret number 10 is due to scoliosis. What is scoliosis? Scoliosis is an abnormal lateral curvature of the spine, and that can result in damage to the spine as well as damage to the neurology and also problems with the internal organs. Now, let me explain to you what normal looks like for the spine so that we have an understanding of what normal looks like, so then you can recognize abnormal. When you look at this spine straight from the front or from the back, it should be straight up and down like a column that holds up a building. When you look at the spine from the side, it has a gentle S-shaped curve to it, but when you look at it from the front, it should be perfectly straight. What's going on with scoliosis is that you have a sideways bend going on in the spine. And this bend right here can occur lower in the lumbar region, or it can occur in the thoracic area. It can occur up here in the cervical region. Regardless of where this occurs, a lateral curvature of the spine is abnormal. It's an abnormal structural problem. And that can result in wear and tear in the spine. It can definitely result in chronic ongoing back pain. Now, there are a bunch of different types of scoliosis that have been categorized. The first type is called congenital, and that means it's from birth. So as soon as the child's born, they notice that one of the hips are higher than the other, or that they have a high shoulder and they've got an abnormal curvature right from birth. And that happens roughly 15% of the time with people with scoliosis. Another type of scoliosis is called idiopathic scoliosis, and the word idiopathic means unknown cause. This is what's going on in approximately 65% of the cases. Most of the time, these types of presentations don't occur until puberty. And so that's why when the kid reaches about 11 or 12 or 13, they start to get screened by the school nurse, who does a specific test, have the kid bend over, and then she observes their spine to look for any kind of lateral deviations that could indicate that they need further checking by a chiropractor or some kind of a spine specialist, an orthopedic surgeon or a neurosurgeon. And there's no real reason why that occurs. We don't really have an explanation for why this occurs with kids. A lot of research indicates that it has a genetic linkage, but it is age specific, and we find that it is very, very common to see this with teenagers, with kids hitting puberty. And then there is another type of scoliosis, a third type of scoliosis called secondary scoliosis, and that is due to neurological problems or spina bifida or cerebral palsy, and that type occurs approximately 20% of the time. Now, what's going on with scoliosis is that you're getting some kind of a structural deformity to the vertebrae themselves. The vertebrae are starting to wedge, and they're becoming abnormally formed, causing either a rotation or a lateral shifting in the spine. And this is generally diagnosed with X-ray. They take frontal X-ray views, shooting the X-ray beam right through the front or from the back, and that way the doctor can measure if there's any kind of a curvature, and then they can actually take measurements and find out how bad is it. Now, how do you know if you need surgery or not? Typically, a surgeon will not even get involved with the case unless the curve is 45 degrees or greater. If you have a very slight curve, if it's 10% or if it's 20% of a curve, or not percent but degrees, if it's 10 degrees or 20 degrees, they're not going to touch it. They're going to say, well, you just need to go to physical therapy or chiropractic care and learn to deal with it. And that is true. You don't want to have somebody operating on your spine if you don't have to. There is an approach that I have in my office called mass correction, which is MASS is an acronym that stands for motion, alignment, and strength. And so my goal is to restore movement, alignment, and strength to the spine. Now, I want to be clear about something. If you're an adult, you cannot cure a scoliosis. In other words, you can't straighten it out through chiropractic care. It may have happened occasionally, but not predictably. So I don't want to make false claims. You can't correct a scoliosis, but what you can do, and what is a very good goal to have, is to restore function to the maximum amount possible through the patient. And that is by keeping the joints moving, It's by keeping the muscles functioning correctly. It's by aligning the spine to the best possible way that you can, and also strengthening and stabilizing the spine through specific exercises that the person can handle. Not all exercise is good for you, and certain exercises that you may be doing actually may be doing you more harm than good. For example, if you've ever been driving a nail with a hammer, and if you've ever bent the nail, if you keep hitting that nail that's bent, it doesn't straighten out. In fact, it keeps getting worse and worse and worse. And so the same thing happens if you've got a scoliosis and you're running and you're doing high impact things to your spine. It's like driving a bent nail. It keeps making it worse and worse. You should be under the care of a doctor who knows which specific exercises that you can handle. It can design a program for you that's not going to aggravate your problem or make it that much worse. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about scoliosis, please feel free to communicate with me through my website at redapplewellness.net. Also, please subscribe to my YouTube channel and please tell a friend. And again, thank you very much for checking out this video.